Hi, my name is Chantel Brimley. I'm going to be doing a physical assessment on my patient that has a pulmonary embolism. So I'll show you my name, make sure you know that's me. Good. All right, so we're going to go grab my patient and then we're going to come and get started. So if you want to follow me, Mrs. Jones, will you please follow me over here? Hi, how are you today?
I don't feel so good.
No, you look like you're limping, having some trouble breathing.
Yeah, it's hard to breathe.
All right, go ahead and have a seat. If it's better to sit up or lay down, make yourself comfortable. So at this point, I've assembled all of my equipment. I have my blood pressure cuff, pulse ox, thermometer, stethoscope. I'm going to wash my hands and introduce myself to the patient. So, hi, I'm Chantel. I'm going to be your nurse today.
Hi, I'm Mrs. Jones.
Hi, Mrs. Jones. Can you tell me your full name and date of birth?
My name is Sarah Jones, 12/22/72.
Okay. Great, that's what I have here. So can you tell me what brought you in today?
Well, all of a sudden last night in the middle of the night, I started feeling really short of breath. So I thought I'll just go to bed and everything will be fine. But about 5 o'clock this morning, I woke up and I was even more short of breath. And then I went onto the couch and I couldn't catch my breath. And then my husband came up and he stood me up and I collapsed onto the floor.
Okay. That doesn't sound very fun. Okay. You looked like you were limping in here. Does your leg bother you?
Yeah, I must have pulled a muscle in my calf. It's been hurting for about 3 days.
Okay, about 3 days.
Mm-hmm.
What kind of medical history do you have? Have you ever been diagnosed with anything or take any medications for any
You know, I've been
conditions?
really fortunate. I have been really healthy, except for I've got really bad back. And about 2 years ago, I had a discectomy for herniation, and then a year after that, I had another discectomy. And then this year, I herniated it again, and I had a fusion. So I just had a back fusion about 2 weeks ago.
2 weeks ago. Okay. And you've been obviously pretty immobile this whole time during this.
Yeah, I was in bed like 4 weeks before I even got the surgery, before I could even get it taken care of.
Okay.
Yes.
Okay. What medications are you currently taking?
I'm just taking pain medication right now.
Okay. Do you know the name of that?
Hydro something.
Hydrocodone?
Yeah, that's it.
Okay. Do you know the strength at all?
I think he said 5.
Okay. And do you have any allergies to any medications?
Just morphine.
Morphine? Okay. Well, if you don't mind, I'm going to just take a look over you, get some more information for the doctor so we can get figuring out what's going on with you.
Okay.
Is that okay? Okay. So I'm going to first start with a respiratory look over. So first going to be looking at her. I'm going to be looking at her respiratory effort, seeing how fast she's breathing. I'm going to be looking at, obviously she's having trouble breathing, so she's using her accessory muscles to breathe, specifically her intercostals. It looks like her chest is symmetric. I'm going to look for spinal deformities. I'm obviously going to have her be more unclothed than this, but for the sake of privacy, we're not going to do that today. And she obviously has an incision from her fusion. And then from the looks of her skin, she looks pale. She kind of has a bluish color around her mouth. Tells me that she's not oxygenating very well. And actually before this, I would have gotten her vital signs. So I'd get her blood pressure, which her blood pressure would show a pretty low reading. I'll take it now. I have to relax. And then I'm going to take the temperature. Maybe. Temperature is normal at 97.5. And then I'm going to get her pulse ox too while we're waiting for the blood pressure. This. Okay. She has a pretty fast rate of about 118. Her pulse ox is setting at 86, so she's obviously having problem saturating. So at this point, I would obviously go out of the room, get her some oxygen. She obviously doesn't need that because she's not real, so we won't do that. Her blood pressure is, we'll tell her right now, maybe. Okay, for sakes and purposes, we'll say it was 86 over 50. Sounds like a good reading for pulmonary embolism. Now I'm gonna palpate her chest. So I'm gonna have her sit up for this. I'm gonna touch you now and just kind of feel how your chest is expanding, okay? So take a deep breath in for me. Okay, take a deep breath in. Okay, that feels symmetric. Now I'm gonna feel for any tenderness or masses, crepitus. Up here, are you having any pain or tenderness here? Here? Okay. So I don't feel any crepitus. It's not tender. I don't feel any obvious masses. So we'll go on from here. And then I'm going to have her sit straight forward. And we're going to do some fremidus to listen to make sure there's nothing going on there. So I'm going to put my hands on your back. And then you're just going to say the word 99 as I go down your back. Okay?
99, 99, 99, 99.
Okay. And everything feels normal from there. Now I'm going to percuss her lungs, see if she has any consolidation or anything like that. So I'm going to start anteriorly and percuss there. Good. And then now I'm going to do it on her back. I'm doing that in a ladder-like motion. Now I'm going to test for diaphragmatic excursion. So what I'm going to have you do now is I'm going to have you exhale all of the air that's in there, and I'm just going to be tapping on your back. And just make sure you hold that until I tell you otherwise, okay? So go ahead, take a deep breath out, or take a breath out. Okay. Okay. Now go ahead and take a few normal breaths. Okay. And now I want you to take a deep breath in and hold it until I tell you not to. Okay. All right. So normal diaphragmatic excursion. Now I'm going to be auscultating with my stethoscope her lung sounds. Do you care if I listen to your lungs now?
No.
Okay. Take a deep breath in. Alright, and now I'm going to listen in the back. Deep breath in. Deep breath. Okay, so with a PE, you're not probably not going to hear breath sounds in this case. I don't hear any breath sounds in her right lower lobe.
It hurts when I take a deep breath too.
And it hurts, okay. Now, that's the respiratory assessment. So now the next system that I'm going to evaluate is the cardiovascular system, because that's going to be probably another system that's going to be affected by a pulmonary embolism. So I'm going to first look at her, I'm going to have her lay back and be at a 45-degree angle. And I'm going to look at her pulsations. I'm going to look at if there's any jugular venous extension or anything like that. So I'm just going to take a look here. Turn your head. Okay. Turn your head to the other side. Perfect. Okay. And then I'm just gonna look at her chest, look at the precordium, see if there's any masses or anything like that. Now I'm going to palpate the carotid and the jugular veins. So I feel on this side first. Any pain here? Okay. And then I would feel for the precordium, it's going to be over here kind of by her left breast. But for sakes and purposes, I'm not going to touch her there. But I would feel for that. Now I'm just going to auscultate all of her, the carotid and jugular arteries. I'm going to listen to precordium. And I would do this while she was sitting up, laying down, and in the left recumbent position. But for time purposes, we're just going to have her sit up while I listen to her heart. You want to sit up for me? Heart sounds great. And then I'm just going to percuss for any cardiac dullness. So it's over here. Okay. That's great. So we've done the cardiac system now. The next system we're going to look at is the peripheral vascular system. I'm going to inspect. Obviously, again, the color of her skin's pale. She has bluish color around her mouth. I am going to look at her cap refill, so if you want to hand me your hands, and I'm just going to squeeze, and she has an abnormal cap refill at 5 seconds, and then I'm going to just look at her, have her lay down. I'm going to look at her abdomen, look at any masses or anything there. I'm going to look at her extremities, both upper and lower, so if you want to go ahead and lay back for me. Okay, so I'm going to look at the abdomen, look at the shape. I'm going to look at any pulsations or veins. I'm going to look at the lower extremities. They look pale, but the left leg looks a little bit more swollen than the right leg. So she definitely has some edema there. There's no redness, even hair distribution, things like that. So now I'm going to check her pulses. So I'm going to start with her temporal arteries, and then work my way down. So I'm going to just feel your pulses right now. So I'm just going to feel for your temporal pulse. Okay. And compare it. Now I'm just going to feel your carotid. Okay. Now I'm going to feel your brachial. If you just want to lift up your arms for me. I'm going to feel your radial. Even. And then I'm going to compare it to her heart and see if it matches. Okay. And then we'll do ulnar. So on the other side, it's a little bit harder to palpate because it's deeper. And then I would work my way down. I would feel her femoral pulses, and then I would go under her knees and feel her popliteal. And then I'm going to feel her dorsalis pedis pulses, and then her posterior tibialis. And those are all, they all feel normal. You can feel them evenly. They're about a 2+ and everything, so that feels normal. Now I'm going to palpate her lymph nodes, see if there's any abnormalities there. I'm going to start up with her cervical, so I'm just going to kind of go from here. Do you have any pain or discomfort here?
No.
Okay, I'm going to go down. Any more pain, discomfort? Okay. And then I would also feel her inguinal lymph nodes. The last